This is a News 3 special report. What every family needs to know about opioids. Sponsored by the DEA, the Mark Wahlberg Youth Foundation, and Walmart.
Welcome to the special on the opioid crisis. The subject here, what every family needs to know about opioids. I'm Marie Mortera.
And I'm Latoya Silman. During the next 30 minutes, we will explore the opioid epidemic in our community, learn the depth of the problem, hear from our friends and neighbors directly impacted by it.
And following this TV special, we encourage you to join us online for a live discussion on the News 3 LV Facebook page or drugfreeisuptome.org, where we will also take your questions. First to join us in this discussion, the Mark Wahlberg Youth Foundation. Fighting the opioid epidemic is a personal one, and to explain that is the foundation's executive director, filmmaker, activist, and author, Jim Wahlberg. Thank you so much for joining us, Jim.
Thank you. Thank you for having me, and thank you for having this very important conversation.
Yeah, absolutely. The core topic here is what every family needs to know about opioids. Why is the family a crucial part of solving this national problem, Jim?
Well, I mean, first of all, I think most young people get their first opioid from either their own medicine cabinet or somebody they love's medicine cabinet. And so if there's ever one sure thing that every person can do to make a little difference, in some cases a very big difference, is to lock up their prescription opioid medication. If they're prescribed it by a doctor and they're taking it properly, they don't want it falling into the wrong hands, because someone could overdose and die. Someone's going to sell them. So they're going to end up in the hands of your children or one of their friends, and something bad is going to happen.
All right, let's perhaps take a step back here. Why is opioid misuse and addiction the focus of the Wahlberg Foundation?
Well, that's a great question. And I could come back and say, why isn't it the focus of everybody, right? When you lose hundreds of thousands of young people over the last 15 years, and we're talking probably close to 1 million people, somebody should be doing something. Somebody should be stepping up. This is not the kind of thing that anybody can say, well, this doesn't happen in my neighborhood, or this only happens over there, or this only happens to those people, whoever those people are. This thing crosses every line. And this is in economically challenged communities as well as wealthy communities. And it's in all races, colors, creeds, religions, you name it, have all been impacted by this epidemic.
Let's talk about where we are, the COVID pandemic, and it's making it hard for people to connect with each other in real life. Do you think this is going to have an impact on people as it relates to substance use disorders? And what about people in early recovery?
It's absolutely had a huge impact on that community. I'm a member of that community, and I say that proudly. Here's the thing. So addiction is loneliness, separation, isolation, sadness. Recovery is connection, love, friendship, brotherhood, sisterhood. It's belonging to a fraternity, if you will, right? And it's a supportive community. And early on in recovery, the number one thing that people tell you is don't isolate, don't be alone, stay with people in recovery, stay in the middle of these programs, right? And now you're being told, stay at home, stay away from people, isolate. It's a perfect storm, if you will, for addiction. And for many, it has, it has broadened a lot of my own horizons, right? I've made it a point to pick up the phone more. We're always walking around with this thing in our pockets, right? We're always on it. Everywhere you go, you look, people are on their phone. But what I want to do is I encourage you to say, hey, I know so-and-so was new in recovery, or was trying to be in recovery, or was going to treatment, or is in recovery for whatever the length of time is. And I just want to call and check on them, see how they're doing, let them know that their recovery matters to me, right? A simple call like that could make all the difference in somebody's life.
Advocacy and support bit by bit. And Jim, I want to say thank you so much for being willing to share some of your own personal story. You are someone in long-term recovery. What is your advice to a person who is feeling like they are finally ready to get help?
Again, pick up that phone, right? The help is available, right? There are treatment centers now across the country. There are 12-step programs available. We're on Zoom now, right? Zoom and these new platforms have sort of opened the world a little bit to people. So you could be at a meeting with people from all over the country or all over the world, right? So you can meet people, you can still connect with a supportive community. It just it's not as in person. But encouragingly, I see things starting to trend towards people now. It's like people are coming out of their house after, the storm, right? People are starting to come out. People are starting to reconnect, but it's going to be still a long road. So you got to use the resources that you have available to you. And if those resources ain't enough, there are many, many numbers. You can just go on to Google and say, find a treatment center, and 150 of them will pop up for you.
The resources are out there. Jim, I think we have time for one more question. What's one specific thing grown-ups can do to prevent kids in their own homes from being exposed to opioids?
Well, yeah, I think the number one thing is you have to have that conversation. You have to have communication with the young people. Young people are under a lot of pressure out there, right? Both with social media and everything else, but with experimenting with these dangerous drugs, right? When I was a kid, people started with, there was a more sort of traditional, if you will, path to trouble with substances, right? It started with cigarettes and it progressed. Now young people are starting with the most dangerous drugs known to man. They start there. And if this is a progressive illness, where do you go from there? Where do you go from the most dangerous drugs? So you need to have the conversation. You need to talk to your kids, and you need to talk to everybody's kids. Even if they're not your kids, we should be warning young people about the dangers. And also we need to warn them that just because somebody has a white lab jacket on and a stethoscope on doesn't always mean that they're our friend. Now, I'm not saying that doctors are bad people. That's not what I'm saying. Their job is to take away your pain. And if they think that that particular drug is going to take away your pain, it's a pretty good chance they're going to prescribe it to you. And if, this is the most addictive substance known to man.
Jim Wahlberg, you are an important part.
It's dangerous.
Yes, and Jim Wahlberg, you are an important part of this powerful conversation, a conversation that we hope will save lives. Thank you so much for joining us here.
Again, I want to thank you, and I want to thank your community and your channel and your station for having the courage to have this conversation in prime time, because people are in dire straits, and if we open up these conversations, we chip away at the stigma, and maybe somebody will ask for help.
Jim, thank you, and stay well.
Thank you.
Now we'd like to introduce Jessica Johnson, Senior Health Educator with the Southern Nevada Health District. Thank you so much for joining us, Jessica.
So glad to be here. Thank you for having me.
No problem. Well, this is a very important issue, but a lot of people may not even realize exactly what opioids are or if there are even different types. Can you explain?
Sure thing. So opioids are a class of drugs used to reduce pain. This class of drugs includes illegal drugs like heroin, synthetic opioids like fentanyl, and pain medications available legally by prescription like oxycodone, codeine, morphine, and many others. There are different levels of purity and potencies of these opioids, but as far as your brain is concerned, they all register as the same thing.
Right, and you mentioned some that people can get from their doctor, and for that reason, that may be one of the reasons why people run into dangers with them. What is exactly the risk of misusing opioids?
Taking opioids not as prescribed or particularly in combination with other substances is dangerous. Misusing opioids can increase someone's risk for overdose death, and it's important for listeners to know that this risk increases when opioids are mixed with other depressant drugs, particularly alcohol and benzodiazepines. Together, these can slow your heart rate, make it difficult to breathe, and can lead to overdose death.
And why are they so addictive in the first place?
That's another really important question for listeners to know. So opioids numb pain. They numb all kinds of pain, physical pain, emotional pain, and others. They mimic chemicals found in our brains like dopamine, and they hijack these reward pathways from our body's natural processes, and that can lead someone to become dependent on those substances rather than on their body's own system.
All right, so can you go ahead and tell us, is there anything that you think the community should know to better help those who may be suffering with an addiction?
There are many things that folks can do. I'll name 3 here to get started. So first, if you have unused medication in your cabinet at home, we encourage you to dispose of it safely through either the DEA Take Back Day or through one of the many medication drop boxes in our community. Those are located at select pharmacies and at metro area commands. Additionally, you can be trained to carry naloxone, the opioid overdose reversal medication. And if you witness an overdose, respond to that overdose by calling 911 and administering naloxone. There are laws in place to protect people who call. And third, to understand the process of addiction as a disease, to know that it's not a moral failing or a crime. We encourage the people that you love to seek evidence-based treatment and know that recovery is possible. There is hope.
All right, there is hope. That is a good way to end it. Thank you so much, Jessica Johnson from the Health District.
Thank you.
What every family needs to know about opioids, News 3 special report will return in a moment.
Welcome back. You're watching a new special on the opioid epidemic, and we're sharing some of the local resources available for anyone seeking treatment for yourself or perhaps for a loved one. The Prevention, Advocacy, Choices, and Teamwork Coalition provides some valuable resources to prevent substance abuse misuse for all ages. And joining us now is Jamie Ross, Executive Director for the PACT Coalition. Thank you, Jamie, for joining us.
Thank you for having me.
Yeah, our pleasure. So just off top, looking for treatment options can really be overwhelming for people. Is there one place that people can look for treatment, that they can go and find those treatment options?
Absolutely. So if you're here in Nevada, we recommend the local treatment locator website. It is behavioralhealthnv.org. That has every treatment agency in Nevada listed. It talks about what they specialize in, what insurance they take. That is an absolutely amazing website, and it was actually created by the Department of Health and Human Services. Also nationally, if you're looking to get someone access to treatment nationally, if you go to findtreatment.samhsa.gov, that is the national treatment locator. And again, that's another government website because unfortunately a lot of, if you just Google it, you're going to get a lot of private for-profit agencies that are paying a lot of money to Google to get their search results up first. So if you go to those 2 websites, that'll give you really unbiased answers to your sorts of questions.
Okay, I love it, a one-stop shop. Let's talk about prevention, because obviously that's the main goal. So where can people go to find prevention information, including how to talk to your kids about substance abuse?
Absolutely. So we are the PACT Coalition. We're here in Las Vegas. We're a local nonprofit focusing on prevention. So if you go to our website, which is drugfreelasvegas.org, click on all of the links. It has information about agencies that we partner with, agencies that we fund, all of the treatment programs, all of the prevention programs here in Las Vegas, all of the ways you can get involved, as well as information about all of the drugs that you may be interested in, have questions about, and how to talk to any loved ones that you have, any family members about substances if you're concerned. If you just want to get more information, drugfreelasvegas.org.
Okay, and we know as we talk about prevention that there's also a way to prevent loss of life, and that's with Narcan. Can you tell us more about where people can get Narcan? How do they actually train to use it, and so forth and so on?
Absolutely. So Narcan is an overdose reversal drug. So if you overdose on an opioid, it is a drug that will reverse the overdose. There's 3 ways you can get it. If you are ever prescribed an opioid, you should always ask to get prescribed Narcan as well. just in case. You can go to any pharmacy in town and they will give it to you, but there might be a cost associated with it. Or if you don't have insurance or you would like it for free, if you go to our website, drugfreelasvegas.org, click on Narcan and fentanyl, it'll show you all of the places you can go. You can also email Southern Nevada Health District at od@snhd.org, and they will get you access. All of those will get you a free training, teach you how to use it, and then send you free doses. And all of that is totally free.
All right. And lastly, what can people do if they need immediate help or support?
Absolutely. So if someone is in immediate danger, we always want to call 911. But if you need someone to talk to, if you are concerned about a family member, a loved one, if you're concerned about yourself, if you know that life is really hard for a lot of us right now, you can just call the number 800-273-8255 or 800-273-TALK, and that is Crisis Support Centers of Nevada, and they are here local and they will help you. They have access to all of these resources and can connect you to anyone that you need to talk to.
All right.
And all of these resources that we've talked about, because I know that this is a lot of information, if you go to either our website, drugfreelasvegas.org, or the DEA website, drugfreeisuptome.org, all of this information is in both of those locations.
All right, some excellent information and resources. We thank you so much, Jamie Ross, for joining us. We know that this information is going to help someone out there. Thank you.
Thank you.
A crucial part of the fight, local law enforcement, and we wanted to bring in the point of view of the DEA, the Drug Enforcement Agency's Las Vegas District, about the epidemic here. And to help us learn more, Assistant Special Agent in Charge Danielle joins us now. We want to thank you so much for joining us and spending your time with us today to give us some more insight. Now, you spent 20 years with the DEA. How has the fight changed over the years, and what does that fight look like in Las Vegas today?
Well, it has changed quite a bit. I mean, back in the early times when I was a young agent, we were battling, cocaine and methamphetamine on the streets. Now it's changed into more of a prescription pills fight and methamphetamine fight here in Las Vegas. And, the last couple of weeks to months, we've seized records amounts of both. So we're very busy here in Las Vegas.
And how does that change the fight against it, especially when you're talking about something that people can get legally from their doctor in many cases?
Well, I tell you what, it's changed in the sense that you're seeing more of DEA agents like myself going out and speaking to the public, speaking to the news teams and saying, hey, listen, we can try to arrest people for doing what they're doing wrong, but it's going to take more than that. It's going to take every single one of us talking about this problem, getting the word out. Talking to our friends, talking to our neighbors, talking to local press about that. And I think that's what's changed. You're seeing more and more of DEA out in front talking about this issue and wanting to have conversations about it.
Right. And a lot of families may know about the dangers, but for those who don't, what would you tell them? How are you all getting that message out to them? I know you're talking to the media, but are you also, once you come across these families, letting them know that they need to pay attention to certain things?
Yeah, what we're doing is that we've done a lot of programs recently. We've done the Opioid Youth Summit that we do every year at the Venetian. We're talking to kids, right? Because I can just tell you, there has been an incredible amount of increase of kids ages, 0 to 18 of overdosing on drugs. And so we're getting that word out. We're working with Clark County School District, having these opioid summits, talking to kids in high schools to try to prevent that from happening. In addition to that, we've teamed up with Victoria's Voice Foundation, the Raiders, UFC, Smith's Grocery Store, and it's really a whole of community effort to get the word out and start having these conversations. Because again, I think in the past, we didn't talk about it. DEA focused in on the arrest aspect of it, and now it's basically a 360 type attitude of we're trying to encompass everything: community involvement, talking about the problem, regulatory side, and then also the aspect of having to arrest people if need be when it comes to this.
Right. So it seems like it takes a village type of approach where you want to be proactive instead of getting them on the back end. Now, a record number of drugs were taken during the last drug take back day. Can you talk more about the upcoming event, the drug take back day, how it works and how that's so beneficial to our community?
Yeah, it's April 24th. It's a Saturday from 10 to 2. We'll have those locations readily available in the next couple of weeks. It's a great program. Listen, one of the biggest concerns is that people leaving their medicines in their cabinets, kids or friends or family or whomever goes in and takes the unwanted prescription. And a lot of times you may not even know it's missing. If you've forgotten about it, you've left it in your medicine cabinet for a while, you may not even know it's there or missing or anything like that. And what we do is we take it back, no questions asked, and we dispose of it safely, properly, and the right way of doing it and getting those off the streets. You know, one of the big ways of kids getting involved with this is people breaking into people's houses, going over to friends' houses. And it just really eliminates that by having this take back day.
Yeah, that's something really important because a lot of people may not realize, you know, hey, that prescription that they got for, you know, a bad tooth or something way back when, they forgot about it, but they don't realize that is a potential danger to someone else. So I'm glad that you mentioned that. Again, that's going to take place on Saturday, April 24th, and you heard him there. No questions asked. You can drop off your drugs and help our community be safer. We want to thank you so much, Assistant Special Agent in Charge Dan Neal, for joining us. Thank you for the work that you're doing to keep families and our community as a whole safe.
Thank you. I appreciate it. Thank you for the opportunity. I really appreciate it.
The DEA would like to remind you that April 24th is National Prescription Take-Back Day. For more information and locations, visit takebackday.dea.gov.
Addiction impacts families of all backgrounds. The difference in how you access resources and treatment, however, varies greatly. Joe Engel joins us now, and Joe lost his oldest son to substance misuse. Joe, first of all, my condolences. Thank you so much for being here and sharing your family's story.
Well, thanks a lot for having me. I appreciate it. Any opportunity I have to talk about it, I jump at it.
Well, the core of this discussion is what every family needs to know about opioids. This may be difficult, but what did you see there at your family home? The signs that something was wrong?
You know, that's a great question, and certainly it's always the same. It's always what we hear about. You know, the sweaty, the red face, always sweating. They start to lie. Things start missing around the house. Classic. Their grades start going down. It's very, very classic. Counselors start calling. Teachers call, then counselors, and the vice principal, and by that time you know that there's really something going on.
In the midst of your son's substance misuse period, did you feel that there were resources accessible to you? Were you aware of any programs and or treatment options?
You know, here in Las Vegas, I'm a person in long-term recovery, and at that time I had spent many years in an abstinence-based program, and I did not find, you know, it was not readily available. It wasn't easy to find places that I could reach out to for help, that's for sure.
And we'll get into what you've started in just a little bit, but let's talk about all the experiences you've had since your son's death and all of the people that you met along the way. What, if anything, would you do differently if you had the chance to do it all over again?
I would have listened to my gut more often. I would have not believed his, you know, as a parent, you just want to hear, you really want to believe that your kid's turning it around, whatever it is. You really want to believe that. You really want to believe the best for your kid. At least I did. I would have tried harder to get him someplace where he could not escape from. I certainly would have did that differently.
And that somewhere perhaps is the nonprofit that you founded. It's called There Is No Hero in Heroin Foundation, TINHIH Las Vegas. What is that conversation like with families going through a fight of their own?
The conversation is exactly that. Let's get all the cards on the table. Let's find out for sure where your kid is at. And a parent oftentimes will take a blame. What did I do wrong? And I'm here to tell you, you know, the other parents out there, you didn't do anything wrong. You know, guilt definitely. You know, I try to show them that their love for their kid sometimes has to be harsh. And just, it's uncomfortable to have an uncomfortable conversation. And sometimes it's easier just to let them have their way because you're tired of fighting with them. I'd say as long as there's breathing, don't stop fighting. Don't give up.
And Joe, you are certainly part of the community fight. We thank you so much for joining us here and for sharing your recovery story.
Thanks a lot for having me. I appreciate that.
Thank you for joining us. We want to remind you that April 24th is the DEA's National Prescription Take-Back Day. More information can be found at takebackday.dea.gov.
For more information on the ongoing epidemic and resources to help, visit us online at news3lv.com. And we hope you join the live discussion starting right now on our Facebook page at KSNV News 3 Las Vegas.
What every family needs to know about opioids News 3 special report is sponsored by the DEA, the Mark Wahlberg Youth Foundation, and Walmart.